I had the privilege to present the results of the DISCUS trial. The DISCUS was an academic, investigator-initiated international trial conducted in three countries, UK, France, Spain, in patients with metastatic, first-line metastatic urothelial carcinoma, in whom we compare 3 versus 6 cycles of upfront platinum-based chemotherapy before offering 2 years of Avelumab. The design of the DISCUS trial was based on a randomized head-to-head comparison in between 3 cycles of upfront platinum-based chemotherapy, GEM-CIS or GEM-CARBO, depending on the choice of the investigator, followed by Avelumab maintenance up to 2 years, versus the standard arm with 6 cycles of platinum-based chemotherapy, followed by Avelumab for up to 2 years. Patients needed to have metastatic urothelial carcinoma with an adequate performance status, ECOG 0, 1 or 2, platinum eligible, and eligible also to receive immunotherapy. There were 2 stratification factors. So patients were stratified according to the prognosis, depending on if they had liver metastasis and the choice of chemotherapy the investigator decided. The primary endpoints were 2. The first one, the most important one, was the quality of life. The mean change in the quality of life of patients in between the baseline versus the completion of cycle 6 or the equivalent time point in the 3 cycles of chemotherapy only arm. The second primary endpoint was overall survival, but the alpha allocation was very small, only 2%. All right, in the baseline characteristics, both arms were very well balanced for the most important clinical factors for prognosis. And in terms of the outcome of the trial, the DISCUS trial was positive. We met the primary endpoint. Those patients randomized to receive 3 cycles of platinum-based chemotherapy only had better quality of life than those patients who were recruited to the standard 6 cycles arm. In terms of number of patients getting better in terms of quality of life, more patients in the 3 cycles arm got better. In terms of number of patients who got worse in terms of quality of life, more patients got worse in the 6 cycles arm. Unfortunately, the time to deterioration was not statistically significant. There was a trend to improve for those patients in the 3 cycles arm, but no statistical significance was met. Hazard ratio was 0.81. And interestingly, the quality of life got separated from the early beginning. Since patients stopped receiving chemotherapy in the 3 cycles arm, the quality of life improved, and that difference was maintained over time in the questionnaires of quality of life that we measured. In terms of activity, we saw, and this is very interesting, almost the same, very similar, 61 versus 59% of patients that are responding as best response. And interestingly, and I think for daily practice is relevant, no more patients with primary progressions were observed in the short cycles, in 3 cycles. 6% versus 10% of primary progression in the 6 cycles arm. In terms of progression-free survival, the hazard ratio was almost 1.05, no statistical differences at all. In terms of overall survival, the hazard ratio was 1.15, so that means that 3 cycles is not better than 6 cycles, but we cannot claim for the non-inferiority because of the design of the trial. So in conclusions, I think the DISCUS trial is really practice-changing because 3 cycles only of platinum-based chemotherapy upfront before offering Avelumab maintenance has better quality of life than 6 cycles. Now we don't really need to squeeze the chemotherapy and to go beyond 3 cycles. No major differences in terms of efficacy, in terms of responses, in terms of progression-free or overall survival was seen, but non-inferiority cannot be claimed because of the design of the trial. And the last point, and I think very relevant, I think with the DISCUS trial we demonstrated that we can run academic trials showing that de-escalation can be feasible, can be done in patients with metastatic urothelial carcinoma, even in the era of antibody drug conjugates.